Hi, and welcome to this episode of Brainy Moms. I'm Dr. Amy Moore, here with my co-host Teri Miller, and we are coming to you today from a very hot and sunny Colorado.
Yep.
We are so excited to introduce you to a special guest today, a very brainy mom, Dr. Roseann Capanna-Hodge. Dr. Roseann is a psychologist, mental health trailblazer, founder of the Global Institute of Children's Mental Health, a media expert who is changing the way we view and treat children's mental health. Her work has helped thousands reverse the most challenging conditions like ADHD, anxiety, and OCD, mood, Lyme, PANS, and PANDAS using proven holistic therapies. She's the author of the books Teletherapy Toolkit and It's Gonna Be Okay. And because she is so trusted, she has been featured on dozens of media outlets, including Fox, CBS, NBC, Parents, and the New York Times. She's here today to talk to us about child and adolescent mental health and what we as parents need to know in order to help.
Dr. Roseann, I'm so glad you're here with us.
I'm so glad to be here. I love chatting with other brainy moms, and it's all about helping families better their kids' health, whatever is going on, and really using the science to inform how we make that change. So I love being with other nerdy ladies like yourself.
Thank you. Yes. Well, hey, before we get started in the nitty gritty of questions, if you would just give our listeners a little personal story, a little background, tell us your mom's story.
Yeah. So, I actually have been married. This is, in a few weeks, it'll be 26 years. And after you're married 20 years, at least in the area where I live, I feel comfortable telling people I adore my husband and we get along really well. Because, it's not a common thing to really get along with your spouse. And we really have a lot of fun and a lot of joy. And so I, had my doctorate when I was 28, and I had already been married a number of years, and we waited 10 years to have kids. And so I have been holistic my whole life as a daughter of Italian immigrants. And I love to tell people I did this is a million years ago. I did things like did prenatal detoxing and to prepare. And, you have this grand vision of all these things that happen. And so I'm the mom of two boys, and both my boys are special needs. And my 16-year-old Max got Lyme disease at 22 months. And so he has brought a lot of ups and downs into our lives and a lot of blessings through the pain. And what we learned is that he is a kid with PANS, which is the onset of psychiatric issues as a result of infectious disease. And he is, thank God, doing pretty darn good today through a lot of treatments and a lot of things. And I already was a person who was specializing in solutions for struggling kids, been working, as we talked before, 30 years. And then my youngest, Giancarlo, he's the type of kid where you understand why people have 6 kids, because he's just so easy to parent. He's also a dyslexic, but it's so far outside of his identity. It's so funny. He's just, both my kids are really strong, independent kids who know themselves and speak their mind and really know how to connect with their inner voice as well as their higher power. And I just love that. So, they're a lot of fun, and they think their mom and dad are really pretty funny, and they tolerate our obnoxious juvenile humor. And so that's my parenting journey. And it's not easy when you're the mom of kids with special needs, right, in so many ways, but I try to hold on to the blessings and ride through some of those challenges, which sometimes are really outside of our control.
Absolutely. Yeah. We have kids with special needs as well. So
yeah,
we get that. We get that journey. Yeah. So we're having a mental health crisis right now, especially among teens. And so I would love for you to talk to us a little bit about the reasons that we're seeing that both before and after the pandemic.
And your state, Colorado, declared a state of emergency.
I know.
Yeah.
And our county has the worst.
Right. Yeah. I mean, so let's talk about this. So I started the Global Institute of Children's Mental Health right before the pandemic because I already was so concerned. So we've all been working with kids and families for decades at this point, ladies. We look real good. Take care of your skin. And and so what happens is, what is going on? Why is this happening? What's happening right now? Has the pandemic worsened it? Absolutely. We know through survey research in Asia, Europe, and in the States that we do have an uptick in anxiety, depression, and suicidal ideation. This is not speculation. We are getting reported facts, right? We know through the Stress in America survey, through the APA, that 70% of parents report significant stress due to pandemic parenting. Okay, so we know we have stressed kids and families, and even beyond that, there's clinical issues. So what is going on? Why are things, why is the average age of anxiety now age 6? I mean, why has suicide rates before the pandemic doubled, 56% increase than the 10 years before? No one answer, but we do know. We'll talk about protective factors and risk factors for really why are kids going to have a harder time and why are kids going to get through this. But let's talk about what's happening to kids in general. So massive increase in stress, right? And we think we can outwit stress, right? It's like saying, your tires are bad and you're just going to keep riding on them, even though a bad winter is coming, right? So you run this risk, like it's not going to snow today, so I can live on kind of worn out tires. But as soon as it snows, I'm not going to be able to drive my car. And it's that same kind of idea of stress. We think, well, it's just something we have to live with. And yes, there are things we can do to be neuroprotective and really help us, but you can't just wish it. You can't be like, oh, I wish it was better and not take action on it. And so our kids are really these absorbers of everything that's happening. And, we have genetic mutations increasing. We have poor food quality. We do have an absolute change in how there's an increase in kids with special needs, neurodevelopmental disorders. I mean, somebody was telling me, and I don't know the research behind this, but we do know that 1 in 37 children now are born with autism. And they say that in about 25 years at this trajectory, 1 in 4 children will be on the autistic spectrum. Wow. Which I can't even imagine the financial implications of the country with 1 in 4 children being on the autistic spectrum, when the typical child on the spectrum is what we call mid-functioning and needs a lot of services. So many things converging at once. We're fragile. Then this pandemic happens, right? And the biggest difficulty, I think, in the pandemic, besides obviously disjointed education, is social isolation, right?
Yes.
And when we talk about what are things that we know get people through trauma, get through difficult situations. I did a lot of work at Sandy Hook. I've also done a lot of work with 9/11 survivors because I'm outside of New York City, and I had an office in Newtown, Connecticut. And so, it's what helped people get through it, right? What you bring to the table in a stressful event is what helps you get through it, right? So we know if you have good social connections, if you actually have faith, right? And you have support, you have coping skills, which to me is the greatest decline in children today, right? If you think about when we were working in the 90s and the 2000s, kids were allowed to make mistakes. Right. And today, bubble wrap parenting prevails, where you don't want your kid to feel any discomfort,
right. Oh, we've talked about this so much. Right. So much about helicopter parenting and not allowing children to fall and fail in the safety of your loving relationships, right? Where you can catch them on the bounce, right?
Yeah. And what's the neuroscience behind that? The neuroscience is, right, because, we're brainy ladies. I always say brainy, nerdy stuff with Dr. Rowe. We have to look at how neuroscience informs our behavior so that we can improve things for kids, right? And for everybody, right? That's how I base all of my work, my clinical work, is all about science-backed strategies, tools, methods, right? And so, the science says in learning, right? If a child learns, I have a problem, somebody is my life preserver, somebody else is my life preserver, they will then repeat that pattern. If they realize I have a problem, I'm going to get uncomfortable, I'm going to find a solution, they learn you can be uncomfortable and have a solution. And instead, we're just constantly, trying to fix things for kids. Yesterday, I had I think one of the biggest things that's happened in this pandemic, and a trend that I don't like, is, boy, people feel very comfortable being rude. And I live in an area of the world where there's a very intensity in the Northeast, right? Like people are very comfortable speaking their mind, even if it's hurtful. And yesterday I saw a mom I knew, and long story short, there's always a snottiness to this mom. She always is that mom that can't say, my daughter is doing a sport. She has to say, my daughter's the number one. Right. And I'm like, I haven't seen you in a year. And like, you got to tell me that, like, okay, that's great. She's not my bestie. Like, oh my God, that guy's number one, So our kids are in the same robotics camp, and my kid is 10 and her kid is 12. And she said, hey, whatever his name is, hey, make sure you talk to, my kid's name is John Carlo, everybody calls him JC. And he literally said, no. And I said, wow, that's pretty rude. And his mom then came in and made an excuse for him.
Wow.
Now, I grew up, my mom would have said, who are you to say that to somebody else?
Right.
Yeah.
And instead she rescued him. And I thought, wow, you're just reinforcing, right? Rudeness, right?
Sure.
And her response was awkward and then sort of like, well, he's 12. And I was like,
yes, he's strong, 15. Powerful, and competent. He's 12. he can use proper language.
You just reinforced him being a jerk, lady.
Right.
So there's so many layers in, what happens, right? I don't know what that answer was. The kid absolutely is raised by snotty people. So whatever, right? Yeah. And so, but we're losing connection to people. We're losing niceness to people. There are different regions in the country where people still have a sense of community, but I don't think this would have happened when we were more connected, even 15 or 20 years ago, is the point of my story. And so, and I think people are having, like I talked about in the beginning of the pandemic, reentry panic syndrome. Then I was talking about, reentry anxiety. Now I'm talking about reentry socialization. Maybe that's part of it, right? Like, we just don't know how to socialize. But the lack of socialization in the pandemic and the heightened distress of parents has really crippled, kids. And, for those kids that are really struggling, their parents didn't have their oxygen mask on. Their parents were overloaded naturally. I mean, I think every parent that survived virtual learning in this pandemic should have like a Purple Heart.
Yes. Yeah.
I can't imagine having like 4 kids at the table. Like parents I knew had 4 kids, homeschooling, didn't want to be homeschoolers, and we're trying to work or even just make a meal. I mean, that's hard.
Teri, how many did you have at the table?
I have 9 kids all together. There are 6 currently at home, but during all the pandemic, juggling the computer space and the, online space, I had 5. So 2 in high school and 3 in elementary.
Yeah.
It was hard. It was really hard. There was a lot of tears and a lot of frustration, and we need help still.
Yeah. I mean, we weren't trained for that.
Right.
And nor do we have the proper setup. You know what I mean? I think the one benefit is your kids had each other. I mean, there were some kids that were onlys or maybe there's a huge age gap and it was very isolating as parents really tried to work. they
Right.
couldn't give their kids the attention they needed. There's no shame in that. They were doing the
Right.
best that they could. But I think there's ramifications, right?
Mhm.
I think one of the surprising statistics that came out was that for any family that had an immediate family member with COVID, if they had a teen or a young adult at home, 50% had moderate to severe depression after.
Okay.
So whether that's fear, whether that's social isolation because they got rejected, I don't know what the outcome was, but that's a real statistic. And these kids, these families are filtering back, and we still have the same ineffective systems that were supporting kids' mental health in schools, right?
Right.
And they're not, and we have battle weary teachers leading the charge.
Right. And
You know?
systems that aren't really working, and administration is trying to make them work, but they don't really work. And it's been a mess.
So what's
Yeah.
the answer?
Well, I wanted to, instead of just jumping to the answer, I want to kind of veer from our outline here, and also focus on everything that you're saying. Also focus on the social media impact of that, because I know our experience with that isolation was then the kids went towards social media connection as their only connection. And there was rudeness, there was posing, there was over trumped up dramatization, so many different things that I think created false identities. Good friend of mine, her teenage daughter expressed a desire. I need a therapist. I need to start going to therapy. And one of the things that showed up is she had several, not particularly good friends, but several people in her circle, friends of friends, that had committed suicide. And this is what she saw. That person was maybe problematic, dramatic, whatever, not particularly well loved, but they committed suicide, and then they were loved, and they were showered with all this social media praise and accolades. And this teenage girl was getting this strange perspective that her life would be better if she committed suicide, because she would be liked. And it was this strange mix of, wait a minute, but then you'd be dead. But she didn't have the maturity to understand that doesn't work. These people you're seeing that are now dead and now loved. Anyway, so I would love for you to address that. The pandemic, social media, what have you seen how that has played out?
Yeah. I mean, and there's a lot to unpack there, because I want to talk about suicide too, right? So let's start with that, and then let's talk about the technology. So one, I do a lot of training for professionals about suicide risks. And I do a lot of work with very complex cases, and I'm not afraid to work with kids with suicidal ideation when they follow my program, right? Like, so they have to do some very intensive work. So I don't just take anybody. It's a lot of work. There's a lot of layers on it. And I use science-based approaches, and it puts people outside of the comfort zone. I'm not using meds and therapy. We're using very deep types of therapies that really get to those root causes, and then require a lot of the kid and the family. There is no working with me without the family being a part of it. You don't get to work with me. That's how it works. So suicide risks. So somebody else committing a suicide in the circle is one of the biggest risks of suicide for a teenager, because of exactly what you're talking about, Teri. There's a mixed message, there's confusing, there's intention. It becomes in their subconscious an option where maybe it wasn't before. And we also have kids with poor coping skills in general. So they have these very uncomfortable feelings of grief and loss and fear, and they don't know what to do with it. And they see somebody else who had a suicide. So the number one suicide risk for a teenager is a breakup, just so everybody knows.
Wow.
So we can never dismiss a breakup as a leading factor in a suicide. So there's a whole bunch of other ones, but that is definitely one of it. So let's talk about technology. So kids, 2019 research, kids 7 to 12 are spending about 4.5 hours a day on technology. This is 2019.
Oh my
Teenagers, it's 7.22 hours.
A day.
A day. So I'm going to tell you that is a low estimate after the pandemic. Like, let's see what 2020 and 2021 says. Now, what does the research say about technology usage? It actually is the quality of the technology. What they're doing online is more directly tied to their mental health than the amount of time, right? So passive engagement, scrolling on Facebook, YouTubing is tied with greater anxiety and depression. And active social engagement is tied to some improved mental health. Now, with that, right, which is shocking, right? Now, my bigger issue is, what are kids missing when their butts are sitting all day on technology? That is my bigger issue, right? So there's less movement. You're not getting lymphatic drainage. You're not getting endorphins in the brain. You're also training the brain to 2D processing. You're not doing visual spatial. You're also training the brain to not, I say all the time, you have to power down to power up, right? You need some downtime. So they're not used to downtime. Kids have a much lower threshold for boredom, and creative play is going down, right? And creative play for younger children is where they learn to self-regulate. So we're now seeing a greater dysregulation and more problems with attention with older kids. And there's definitely a correlation. And then my biggest problem with technology is exactly what you said, Teri, is we've moved to less explicit bullying and more, exclusionary bullying.
Right.
So these kids are doing threads, and they're, on Snapchat, and they drop somebody off. They do these things, and then parents, just like the snotty mother yesterday, seem to make excuses. Like, used to have like community and accountability. Like, it's like a family, you would try to work things out with kids. You say your kids you don't have to love each other, but you have to be respectful and get along. And we never excluded people. I don't remember excluded anybody on my motley crew in my neighborhood in the 80s. Like, I don't remember that in the 70s and 80s. You just played together.
Right.
And that's just the way it was. You know what I mean? Like,
yeah, we were stuck with each other. You had to make it work.
You made it work. Yeah. So it didn't mean they were your best friend, but you were never rude to people. Right. You know what I mean? We did get in some fist fights. I'm not going to lie, but but then you were friends. You worked it out. You know what I mean?
Yeah. So you had to, you couldn't just drop them from your group. They were there.
We didn't have tons of play dates and this and that. Like, it just wasn't that. Your parents were like, get out with the kids in the neighborhood. So, these kids today, there's not an acceptance for kids, and they exclude. And a lot of times when other parents confront other parents, the other parents say, well, he didn't do anything. This is what I hear all the time. And I hear this a lot with special needs kids. And, 54.2% of kids in America, 10-year-old research, have a physical or a mental health problem. So our kids are unique, and it's the norm, people.
Yeah, okay.
So don't think you're any better.
Yeah.
Lady whose kid was rude to me yesterday.
Right. I love it. I love your next question, Amy. What's the solution?
Yeah. So, and your question was, what was the solution about schools before, right?
Yeah, and everything.
I have a vision. Well, I have lots of solutions. I mean, my whole thing is solutions for struggling kids, but these are just things that, are helpful for everybody, right? We look about, what does research say? What does the brain say? And, I go to research all the time. I think most of the time you need common sense people. Okay. But I go to research because I don't want to hear, but is a pill going to fix it? Because that's what I do all day long. Okay. And a pill does not teach skills. It doesn't teach anything. Right. And so we are always looking for a quick fix when often there's some damn work that's got to be done, and it's got to be consistent. And guess what? It fixes the problem, people. So like, the consistency it has to be there. And I think that's a message that's wrong. So whatever the issue is, we have to look at what does the science say about a solution. Okay. And we have to have some consistency, and we never want to say to parents, you're bad, you're wrong, but parents come to us every day and their wheels are spinning. You are working your tail off with zero outcome. So I want you to shift your effort, work smarter, not harder, and actually do what has to happen. Like, for example, I work with a lot of tough cases, right? So, I was talking to a family this week, and I had made a series of recommendations, and they chose to do 1 out of 4 of the big recommendations. So here we are doing X, Y, and Z with just neurofeedback, right? So my process is regulate the nervous system, come in with new learning. That's what I do. That's what works. Okay, people, it works. Okay. And so they chose to try to regulate the nervous system and not do the learning. So what's the outcome? No new learning, right? Okay. So we're not teaching. So I was like, her brain is going to repeat the same behaviors,
Right. Okay.
Oh, right. So we have to look at what helps people and do that. My idea about school is really simple. Okay. And it doesn't cost a lot of money. Okay. So it's called being proactive instead of reactive. Our whole mental health system, our whole educational system is always working upstream. We know everybody's going to be stressed. Why are we going to do the same damn thing? It wasn't working before.
Right.
We need 15 to 20 minute period every day. We need to train the teachers. They need to do mindfulness activities, meditation, yoga, breath work. I don't care what it is.
Right.
Do it, and do it every day. We've got to regulate people's nervous systems. Their kids are not going to be able to pay attention, learn, or take appropriate action with a stress hyperactivated nervous system. This is science, people. So that same thing can be applied across every issue, but we have to actually do this in schools, right? And therapy is great. Not saying it's not great. We are not going to be able to provide that much therapy to every single kid that needs it. And I think we just have to say, okay, well, the first part of this is regulating the nervous system. And I think if we could just support the kids in that, we'd be great if we get families to do it. I think parents, and that's so much of what I do is just to educate people, right? This is what we're doing. We're like, what's the science? What does science tell us? Well, I have never, ever seen more stress activated people. I have never seen more people hijacked. And their responses. I came out of the DMV yesterday, and it was a pleasant experience because you have an appointment. It's awesome.
Better.
Yeah. It was only 35 minutes. It was amazing. And so they have these new licenses that they're rolling out, and you have to give a lot of documentation. I don't know if you've gotten a license in the last couple of years, but you basically, you got to bring a lot, right? It's probably about 5 pieces of documentation to support that it's you. It's called a real ID, and they're rolling it out across, right? So a guy comes out, I'm like, all excited. I got 35 minutes. I budgeted like 2 hours there. And I was like, oh my gosh, I got extra time. And this guy comes up to me, and he's super agitated, right? And he starts spouting off about the ID, and that he couldn't get an ID and they hadn't documented it. Well, I didn't want to tell him. It was pretty clear that you had to bring this stuff, but he was just swearing and this and that. And I thought, okay, I get it, but I don't know you. And he felt that comfortable being that kind of off his, he was at the point where I could see that the guards were watching him,
Yeah,
and I don't think this is unusual. I think this is just what we're seeing, and we've continued to see. And, I've talked a lot about shootings on TV and the media, and, why does this happen? right? You know, I don't have the exact answer, but I can tell you we have such a dramatic increase in mental health problems that are not appropriately identified. We know through research that NAMI says in 2019, they say that it takes 11 years from the first signs of a mental health problem before the average person gets help. 11 years. This is America.
Yeah. And that's a long time to suffer.
It's a long time to suffer. And it's not just the kid, it's their entire family. And I think people are so out of hope. Like when people come to me, I mean, we were joking, my book's called It's Gonna Be Okay, and it's on my mug. But it's literally what I say to everybody, because everybody is so broken and they're so out of hope. And, you know, if we just back things up and if we taught parents, well, guess what? 10 minutes a day of regulating the nervous system, brain training, doing these kinds of things absolutely changes the biological terrain. And we have to do this just like brushing your teeth. Okay. You know, we didn't start brushing our teeth until the soldiers came back after World War II because they wanted good dental care, because they wanted their soldiers to be healthy, because of poor teeth can lead to everything, blood clots, this, that, and the other thing. And then that just became through marketing, became part of what we do. So why can't we do that about stress, stress activation and getting people to regulate? And I think that is the key to what we have to change in mental health in America and get out of this. There is going to be a pill to fix it, because that came through marketing too.
Sure. Yes.
Yeah. Let's get an amen.
Amen, sister.
Oh my goodness. Yeah.
Right?
Yes.
So
the pharmaceutical industry has hijacked the entire field. So
the entire field.
Yeah.
Right.
I mean, I've been doing this talking about these kind of things for 30 years. Mm-hmm. And when I started, I'd be like, I can tell you're into natural. How about trying this herbal supplement? And they'd be like, oh my God, and now it's just so much open. That's great. But, my peers, I mean, I've gotten a lot of flack from peers, even though I'm 100% talking about research. This book has 40 pages of research citations, single spaced.
Absolutely. Yeah.
Okay. So I don't want to hear it.
Right.
So, we're giving kids medications. 70% of the time, psychiatric medications are used off-label. That means no research to substantiate their efficacy. And somehow people feel better about that than adding more fat and protein in their diet.
Yeah, it's because it's the thought that it's the easy fix. I'm just going to give my kid a pill. I don't have to make any effort. All I have to do is make sure they take a pill. And the things that you're talking about, the things that really work, they require effort. They require sacrifice.
Absolutely.
Yeah.
That's reality.
And I like to think of it, as I said, as a change in effort, because our parents with struggling kids are working hard. And they keep doing what is told to them. And I often find they get to me, they're mad they haven't been told this. And I'm like, this is good. I'm glad you're mad. Now you tell 5 other friends about this. Okay. Mm-hmm. And because we have to stop, we are giving away our power as parents. And we are telling parents, no, you can't do that. It's not possible. No, it is possible. 100% it's possible to change, reduce, reverse behaviors. Right. So we know what the brain is capable of to a point, but there's so much that it's capable of. I mean, how can people through guided meditation reduce cancer? We know that through research it's possible. They talk about it all the time. Right. So we're just not tapping in and we're not educating people properly. And, for me, everything is about, again, we cannot think, we cannot process, we cannot pay attention or take action with a stress activated nervous system. It's designed to go offline when you're at maximum capacity. So let's start there, because all the things that you can do with that you can do are simple and free. So there's levels that go beyond that that you can do things like neurofeedback and work with therapists to do somatic experiencing and other things. But it all starts really with breath work and imagery and, positive visualization, and that is free.
Yeah.
So we need to take a quick break, and Teri's going to read a word from our sponsor. And when we come back, I want to hear more about the different holistic options, and then transition into hearing about your new book.
Yes. Is your child struggling in more than one subject in school? Have you tried tutoring but still aren't seeing the improvements you were hoping for? Most learning challenges aren't caused by a lack of instruction. They're typically caused by cognitive skills that just aren't strong enough. Skills like auditory processing, memory, reasoning, attention, and processing speed. Learning RX one-on-one brain training programs are designed to target and strengthen the skills that we rely on for thinking and learning in every subject. Learning RX can help you identify which skills may be keeping your child from performing their best. In fact, they've worked with more than 100,000 children and adults who wanted to think and perform better. They'd like to help get your child on the path to a brighter and more confident future. Give Learning RX a call at 866-BRAIN-01 or visit learningrx.com. That's learningrx.com.
And we are back talking to Dr. Roseann Capanna-Hodge about children's mental health and some holistic ways to address mental health. And so let's dive right back into that.
Yeah, first of all, there's just so many science-backed ways to support kids who are struggling, with everything like your typical things, attention, worry, regulating their mood, their behavior. These are the most common issues that are really surfacing for kids today. And parents don't know that there are many options. And I talk a lot about this in my book, It's Going to Be Okay. But, what are things parents can do? Where can they start? And for me, it all starts with, regulating that nervous system, that breath work, meditation, yoga. If you're worried about meditation and yoga because you're have a religion who feels like that's not okay, well, prayer is also a meditative process,
Right.
can regulate your nervous system. And, there's so much evidence. Meditation, 10 minutes a day for 40 straight days through research. You can look at 40 days of Zen, rewires the brain and helps to regulate the nervous system so people can be more attentive, more calm, process quicker, just in 40 days. And I think when people hear that and they're like, 10 minutes, I could do that. No, okay, you want to up it and do 30? I'm sure you ladies are just like me. 7 days a week. I do multiple things every day to regulate my nervous system. So I practice breath work. Today, before I got up, I was like, you've got to do some breath work before you even get up. So I chose to do more breath work and less exercise today, because I felt like I needed it. It's like Thursday, and by Thursday I start getting worn out because I'm a cuckoo lady running around doing a million things, right? All good things, but your body knows no difference between good and bad stress, and it's still going to kick you in the butt, and it's going to show up as sleep problems or irritability or weight gain, whatever it is, it's going to show up. You can't outwit it. So that's one thing. And then when you have clinical issues, there's a whole world out there of clinical tools that support, not just regulating the nervous system, but that new learning. So, I do neurofeedback and biofeedback and PMF, but we also do very specific types of psychotherapy. So when it comes to teaching, right, we talk therapy is one type of thing, but it doesn't work for a lot of people because they're so stress activated, and we over focus on emotions in therapy when the bulk of people who have struggles are really stuck in a thought process or sensations, right?
Wow.
Right. So I spend work doing a bottoms up approach versus a top down. Not that feelings aren't important, but to me, I always say they're the candles on the cake. Like you do that last. If you keep trying to focus on feelings when a person can't even connect to the sensations they're having, it's not going to stick. So, that means we have very specific types of therapy that can be really, really helpful. And this is kind of mind blowing to people when they don't understand how effective psychotherapy is, because they've tried talk therapist.
Okay.
And this can be for adults as much as kids, people. Like it is as much adults as it is kids. And I actually find kids are easier to work with. Even though I work with adults, I'm going to tell you 100 times I prefer to work with kids and down, because they're so open to learning. They don't tell me they can't do it. It's the parents that tell me they can't do it.
Wow,
Right?
yeah.
Right.
Yeah.
Right.
So there's so many solutions, and, I'm a big fan of supplements, right? I love taking a functional approach, looking at nutrients that kids are missing.
Let me interrupt you for 2 seconds,
Yeah,
Dr. Roseann. So as parents are searching for the most effective therapies, are you referring to cognitive behavioral therapy and dialectical behavioral therapy? Are those the ones that parents should be looking for?
I go even further than that. So
Okay.
specific conditions require certain things. So DBT, dialectical behavioral therapy, is known to support kids with, mood regulation issues and personality disorders. Trauma has very specific types of therapy. So if you've had repeated traumas or more immediate trauma, and we're broadening the idea of what trauma is. It could be medical trauma. It doesn't have to be physical, sexual abuse, or neglect. So your kids could be traumatized from the pandemic, right? And then I do a lot of work with people with OCD. There's a very specific type of therapy called ERP for OCD, exposure response and prevention. It's the #1 most effective therapy type of psychotherapy, but yet we constantly do anxiety therapy for OCD, and all it does is actually increase the neurological habituation. When we treat it like that, it makes it worse. It makes it actually stay there longer. And so CBT, I don't think it's where you start with kids. To me, you start at somatic. You start with teaching them to connect to the body. Some art therapists and play therapists do that naturally, but there has to be an explicit instruction of teaching them, this is a sensation, this is what it's about, right? And we are such a disconnected society. When I think about Teri asking me about technology and what's happening, it's teaching kids to even further disconnect to what their body is telling us. And our body is, every kid, every adult, it's our first cue. When you think about anxiety, you think about how your body feels first.
Yeah.
You don't think about you then go to the thought, and then you go to the feeling, right?
Your heart's racing, you're sweating.
Right.
Yes.
I've got a stomach ache. I mean, I get so many kids with what are signs of anxiety? Gastrointestinal, sleep problems, headaches, pain. This is how kids definitely show their worries. And, our highest functioning kids, right? People use grades as a benchmark for mental health. They think if my kid is a straight A student, they can't be suicidal. They can't be depressed. They can't be anxious. And I think the pandemic shined a light on that. That's not true.
Right.
Right. But every type talk therapy, I'm not saying throw it out. Okay. But we can't approach kids who are activated or adults with talk therapy. All it does is further serve to activate the nervous system. Okay. You do that work when they're regulated. You do the cognitive behavioral, which is amazing, right? Because most people, even kids, they get so caught up in these negative thought loops. And cognitive behavioral is an amazing tool to get them to confront their thoughts and then change their behaviors, right? Mm-hmm. And that's what a good cognitive behaviorist, right? And please know that not all therapists are good or appropriately trained for every condition. And therapists don't like me to say that. But, right. I was a college professor training therapists, and I said, I can't do this. Because you got to work on your stuff, therapist, before you start helping other people. But that's a whole thing.
Right.
But You have to really get a good match, not just with rapport, but with skills, right? Why do people come in and, so I work with people virtually and in person, and I do neurofeedback virtually. I mail them the equipment. Why do people, right now, Asia, Saudi Arabia, Canada, why do they come to me instead of finding somebody locally? Well, because it's an art and a science. Right. And so you are paying for all of the skills that I have. There's a lot of skills there. Somebody would have to spend weeks, what I could probably do in a minute. No offense, but that's just what happens when you've been doing something a long time. You're really good at it. And this is why people want to work with you. So you want to be careful. I'm not saying you never work with a new therapist. I totally disagree with that. You just have to make sure that person has the skill and the expertise and the training in that particular niche area. Don't take your kid with anxiety disorder to a depression specialist.
Right.
It's not going to help you, people. It's a different methodology.
Good. And I think most therapists advertise their specialties. And so it's super important to look at that and interview them and make sure that it's a good match.
Absolutely. And don't go to a generalist. If you're going to a generalist, they're not going to have the niche experience to help support you. They're not unless it's a general basic issue. Your kid needs somebody to talk to. I don't see those kind of kids. The kids I'm working with have layers, right? They have gastrointestinal problems. They have learning problems. They have anxiety. This is now the norm in mental health. I think most issues are not one thing. Like if I just have just a happy little kid with ADHD, I'm like, this is a miracle. Like he's just got ADHD,
So
the parents are
easy.
like, it's so easy. I got that. Don't worry about that, So, by the time, even young kids, by the time they get to me, they have self-esteem issues as a result of that. There's friction at home, it's a layers. It's a lot of peeling back, and they're all addressable. I mean, I don't look at anything as something that can't be improved.
Sure. So I interrupted you, and I apologize. I do want you to return to your conversation about supplements because I'm a fan as well.
Oh, it's funny. I have some great blogs on supplements, and I dive a lot into my book. It's probably one of the most asked questions that people ask me about is like, is there a supplement for this? Is there a supplement for that? Yeah, there's a lot of research to show there's very specific supplements that improve niched areas, right? Like how do I improve impulse control, right? I just wrote a series of blogs on essential oils that was very specific to issues because again, there's a whole world out there and people don't realize how powerful these things can be. So, if you have a child that's struggling with anxiety or OCD or any issue, or you just want to improve how their brain processes, you want to help them get to that next level, then there is a lot of information that has great usages for all of those things.
And those blogs would be on which one of your
websites? drroseann.com. They're all in my book. It's going to be okay too, but there's good information out there, on the internet too,
Sure.
So
well, tell us about your book.
Yeah. So my book, It's Going to Be Okay, is really my life's work. And it really lays out the step-by-step way to have solutions for kids that are struggling. It does, it doesn't matter if your kid has PANS, PANDAS, OCD, whatever it is, there's a platform to support the brain and body on how to improve or even reverse these clinical issues. And, there's a lot of things you can do, which can feel very overwhelming to people, but I break it down where it's like, you're just going to start here and you're going to do this thing. And then some people are like me, I like to jump in the water and I'm like, I'm going to do 10 at once, and that's okay too. And you can use it that way. But I think what people just need to realize more than anything is that little waves create big waves. And so we've got to just start somewhere. Stop, get off the worry train and pick one thing that's got science behind it and do it for at least 30 days.
Okay.
And I like to chart it. Like I like to do a SUDS, like, on a 0 to 5, where's your stress level? Where's this, whatever, and chart it on a calendar for 30 days so that you have some objective data. Whenever I work with people, I'm a huge data collector, and if somebody says, well, there has been change, I'm like, 50% improvement in how your kid gets along with his sister. And that was the top 3 concern. Oh, I didn't realize that, okay.
Good.
So I think that's really important. So this book is really my give back. Not everybody can afford to work with me, even though I can work with people virtually and have a whole team in place to help people. It's really like, please do these things, share this information. And it really these things are proven to not just change the biological terrain, but I use them to change the trajectory of the lives of the kids that I work with.
Wow. Where can we get our hands on it?
You can get it on Amazon, or you can go to itsgonnabeokay.com, and then I have several free gifts that you get it when you show that you ordered it.
Okay.
We'll actually have a link to it in the Brainy Books tab of our website as well when this posts. And I will give you a glowing endorsement. I don't know if the people on YouTube can see, but your other book that you wrote for therapists is actually on my bookshelf. So the Teletherapy Toolkit,
That's right.
And I use it.
Oh, good. That's it for therapists of all kinds, including speech and language. And it's really just a simple, handbook resource guide that you can use, because I have a team of therapists and we've been doing teletherapy for a long time. And this came in and therapists were like, holy cow,
Panicking.
how do I do teletherapy?
The pandemic,
Right.
Yes.
And so I actually wrote that book after the other book, that It's Going to Be Okay. And I wrote it in 31 days.
Wow.
Just to get it out. I'm sure, because it was needed.
Sure.
To
I
get
was
that
like
information.
this, like, shh. And I had
Yeah.
4 interns and they would format and put the graphics in.
That's great.
Yeah.
So we
needed.
did it and we got it, and I feel great about it. And, therapists, I loved having books like that. I mean, I have tons of books that are resources. So
Yeah.
I'm so glad you have it.
Oh yeah. I have a couple teenage clients and I've used several of the activities and
Awesome.
just
Thank
love
you.
it.
So
Yeah.
good.
Because I only do teletherapy.
Yeah.
So, yeah.
See, and we all need tools in our toolkit, whatever it is, right?
Yeah.
Hey, before
absolutely.
we close, I just want to say for our listeners, and I've been taking just copious notes because I want to learn how to apply all these things to my family and to help my kids. I have a house full, and so there's a lot of different perspectives and different age groups. And, my kids suffer in different ways, just like kids are right now. And so if you're listening to this and feel kind of like your head is spinning, what do I do? I'm going to tell you that the takeaway I wrote down, the number one thing I wrote down that I'm going to do different, I'm going to start doing in my home, is I'm going to try to do that 10 to 15 minutes every single day of meditation. And I am not sure right now what that's going to look like. If that's going to be in the morning, maybe it's going to be right before dinner. I'm not sure, because my kids have different schedules, but that is something I'm really inspired with. And so I want to challenge you listeners to just give that a try. 40 days, just try with your kids, with your family. Let's do that one thing and see if we can help regulate the nervous system and see what will follow.
I love that. I love that.
Good
That
stuff is
challenge
going to
to our
follow.
listeners.
And really, even to simplify it more than that, they can do a 4-7-8 breath. So in for 4, hold for 7, out for 8. And if you do
Nice.
that 3 times in a row, right, you're going to regulate your nervous system. You want to do that at least 3 times a day. And you can stretch that out to a 10-minute process.
In
so
for
that's
4.
the 4 in for 4,
Mhm.
hold for 7,
Okay.
out for 8. If
Nice.
your kids are too young, I have breath strategies. I have a YouTube channel. On my YouTube channel, I have some breaths, but you could any type of belly breathing, which is diaphragmatic breathing. So young kids, you can do blowing bubbles, whatever it is. It can be a box breath in and out, in and out. The quickest way to regulate your nervous system is to have that exhalation be a little longer. So even if it's in for 4, out for 5, and you just start training, I started teaching my kids breath work when they were 1. And I watch them sometimes before they enter a situation, stop and breathe. And I was like, I did a good job.
Excellent.
So it's very easy. If your breath is dysregulated, if you're breathing out of your chest, mamas and papas, you are not, your autonomic nervous system, your stress response system is not working correctly. You need to breathe out of your belly, right? So we got to fill it up like a balloon and then out through our mouth. So in through our nose, out through our mouth. And it just helps you get back on track, right? Is this regulating our nervous system is just like, getting your wheels aligned on your car. So that nobody cannot do breath. Right. And so we're breathing anyway. Let's just make it be the right kind of breath to support our, our stress levels, our focus, all the challenges that we have. So important.
Excellent. Awesome. So if there's one last thing that you want to leave our listeners with, what would that be?
It's really that. Just focus on breath. Don't neglect the time that you need for some power downtime, and really the ROI, that return on investment of as little as 10 minutes a day, is pretty massive. And you just got to do it for at least 30 days. Don't do it once or twice and then bag out. Like make a commitment, make your family do it with you. We only have sort of full control of our kids until they're 18. Yeah. So let's teach them this, because again, just like I watched my kid do this before something stressful, I felt so proud that he was using a resource kit. I didn't have to cue him, nothing. And it took time. It takes time for them to develop any new habit.
Excellent. So we are out of time and need to wrap up, but I just want to thank you for joining us today, Dr. Roseann. And I mean, you've just been a wealth of tips and information, and we could talk for another hour or 2 with you. So maybe we'll have to have you back and we can dive into some other topics with you. If you would like to connect with Dr. Roseann, you can learn more about her and her work at drroseann.com or childrensmentalhealth.com. And we'll also put her social media handles and links to buy her book, It's Gonna Be Okay, in the Brainy Books tab of our website and in our show notes. So thank you so much for listening today. If you like our show, we would love it if you would leave us a 5-star rating or review on Apple Podcasts. If you would rather watch us, you can subscribe to our YouTube channel. And please follow us on social media at the Brainy Moms, at Dr._Amy Moore, and at Teresa Miller. Look, until next time, we know you're busy moms and we're busy moms. So we are out.
See ya.